afternoon, good morning, good evening, depending on where you are, ladies and gentlemen. This is an honor for me to be with you this afternoon at the DIDA conference in order to present the first panel titled The New Dynamics and Perspectives in the Diaspora Entrepreneurship Plugging and Soft Landing as Way Forward. With me in that panel today are three amazing people based in different countries, in different continents. And I'm going to start by introducing myself, which would be quite fair. I'm Nabou Fall, and I'm going to be your hostess for that panel. I'm the CEO of Visio, a PR and communication company, and I'm the co-founder of Impact Hub Abidjan, which is an incubator aiming at fostering entrepreneurship and in Côte d'Ivoire. So I am going to introduce very briefly the first panelist, Karine Sourou. She's based in Brussels, and she's the executive director of ADYFE, ADEPT, and she will tell us more about what she does later. Then I have Mr. Mamadou Dakwo, who is the co-founder and CEO of Biowin Pharma. He has it's of course, as you hear, pharma, it has to do with digital health sector. And Mr. Mamadou Dakwo is based in Toronto, Canada, originally from Mali. Karine is from Cameroon originally. And my third panelist this afternoon or this morning that has just joined, Alex, we're so happy to have you. I was getting worried. Thank you for joining. Our third panelist is Alex Tare, CEO of the Rwanda ICT Chamber, and is based in Kigali. Alex is the only one of us currently in Abuja now. So I'm going to hand over to the three panelists on that very important topic to briefly introduce themselves. And Karine, I'm handing over the mic to you.
Okay, thank you very much, Nabou. And good morning, good afternoon, or good evening, well, depending on where you are based. So my name is Karine Sidhu. I am the Executive Director of ADEPT, the Africa-Europe Diaspora Development Platform. First of all, I would like to thank ADYFE for this invitation. I'm really honestly humbled to be here with you today, and I would like to congratulate them for organizing such an event, which is not only relevant, but also perfectly timely, because I think that everybody has witnessed the current momentum around diaspora entrepreneurship. I would like to say also that I was very glad to see a lot of familiar names on the agenda, which proved that even though the migration and development ecosystem is exponentially growing, we are still like a family. So I will say a few words about ADEPT for those who don't know the platform. So we are a network of Europe-based African diaspora organizations that conduct development activities in Africa, but also inclusion and diversity related actions in Europe. Our mission is to amplify their influence and their impact, be it in Africa or in Europe, and we do that by intervening in three distinct areas, namely communication and engagement, policy and advocacy, and capacity development. And when we talk about capacity development, it's quite a broad area, a broad category, because it includes training, it includes technical support, for example, for those organizations that want to create consortium. It also includes financial support, and this is maybe something that is particularly interesting in the context of this this conference, and maybe I will go into detail a little bit later so that everybody has time to present their organization and themselves.
Thank you so much, Karine, for that extensive explanation and introduction of yourselves, and well done. Congratulations for that amazing work that ADEPT is doing. I believe in networks, and looking forward to know more later on. I'm going to hand over the mic to Mamadou. Mamadou is in Toronto. And Mamadou, please introduce yourself.
Thank you so much, Nabou. And can you hear me clearly?
Very clearly, we have you.
Okay, wonderful. So thank you so much. My name is Mamadou. I am a co-founder of BioWin, and I'm very happy to be here. Pleasure is all mine. And I would like also to thank all the organizer for this event. And my company is based in West Africa, and we mainly work right now in Mali and Senegal and Cote d'Ivoire, every Cote as well. What we have is a digital health platform. When we are doing right now is to do an interconnection to build a network of healthcare professionals. And we are doing that because we think that's like one of the best way to make healthcare more easy, to make it like to facilitate the access to the patient who are looking for a care. So I can give you like more detail about the product you are using right now. And so that's what we are doing right now. We are based in West Africa, mainly working in Mali, Senegal, and Ivory Coast as well. So I'm happy to be here, and I really think that's a great opportunity to share and to connect with people trying to make like life better in people living in Africa. And so that will be for my first presentation. I will stop here.
Thank you so much, Mamadou, and also congratulations for that amazing work. Thank you, ADYFE, for giving us the opportunity to discover and meet all these amazing brothers and sisters in the diaspora and in our countries who are doing amazing things. And last but not least, our dear Alex Tare. Alex,
Thank you very much, and I'm very sorry if I'm mixing up the hours. But I'm glad that I'm here, and just like everyone, I want to thank our DIFE team that has invited me to be a panelist. My name is Alex Sinhare, and I'm from Rwanda. I head the Rwanda ICT Chamber. I'm interested in this topic on the new dynamics and perspectives for diaspora, because at one point I was also diaspora. It's now been 10 years since I came back to Rwanda from London, and the journey for me has been very, very rewarding, very fulfilling, and I'm excited. You've invited me to share what we're doing in Rwanda. So I don't know how much I should go into this, but with the ICT Chamber, we represent the ICT companies in Rwanda, or technology companies, and some of our flagship projects have been around innovation. We started off with establishment of Jokkolabs, and today we have grown that not beyond Kigali, because we were working only in Kigali. We've grown to 4 other locations in other districts, other parts of the country. And we've also been working closely with the government, but more so now with tapping into the diaspora brain power to see how we actually can leverage. And that honestly started mostly last year. That's when we started pushing a lot on that, and I'll be sharing more on the journey so far. Thank you.
thank you so much, Alex. Have heard of many words, and the main word I've heard is the connection and connecting. And I think that's what we're here for when we talk about plugging. Plugging means connecting, and connections foster soft landing, obviously, because when you're connected, you get an easy entrance to wherever you want to go. Like tomorrow, if I want to go to Toronto, Mamadou will host me. My next trip in Kigali, Alex will definitely take me for a dinner. You'd have no choice. And Karine, Brussels, yes, I'd rather have you come to Abidjan, please. So, Karine, tell us, how does ADEPT, how do you do that? You've explained to us very briefly, how do you, with ADEPT, create all these networks? How do you meet? How does ADEPT fit into that topic, ADEPT work, and the financing that you've discussed and you've shared with us?
Okay, maybe to start with, we'll have to mention the fact that I am a sort of outlier in this panel because, as I said earlier, before the start of the event, we don't work specifically or directly in entrepreneurship, diaspora entrepreneurship. Nevertheless, when it comes to connecting, to networking, as you can imagine, given that we are a platform of diaspora organizations, it's at the heart of what we do and what we do to ensure that the members of the platform can have some connection, can strengthen the bonds, the relations. We basically use different modalities. The first one being through thematic working groups that we have established. For example, we have a working group on gender. We have a working group on humanitarian aid, knowing that in reality, diaspora organizations and individuals conduct actions in the area of humanitarian, and it's very important. We also plan to activate, to be more precise, a working group on entrepreneurship. And it's very important because it enables the members of the working groups to exchange views, also exchange more specific knowledge, in some case experience and even expertise. So this is the first modality. A second one being the organization of online consultations. For example, given that we are based in Brussels and that we are close to the European Union institutions, it's very important for us to ensure that the views of the African diaspora are taken into account when it comes to migration. So what we do is that we organize online consultations in order to gather the views and the perspectives of African diaspora organizations and to make sure that they are heard by the European Commission or by the EU Parliament. Another modality is the creation of consortium. And in fact, to do so, we provide technical support to the members so that, for example, they can jointly apply for funding. Let's take an example. The European Commission would like to finance some projects when it comes to migration. And if we know that the members of the platform can be interested, for example, on the integration of migrants, we will help them create the consortiums and we will help them draft a proposal. And the fourth modality is the financial support. And DIDA is a very good example, given that ADYFE applied for funding, for ADEPT funding. So they received some financing, and thanks to that, partly, of course, they have been able to organize the DIDA. Knowing that, as you can imagine, knowledge and skills transfer of diaspora individuals and organizations is a priority for us. So I can see some footages of people, I think, in Abuja. So this is basically, these are basically the four modalities that are used by ADEPT to ensure networking, to ensure that the members can get to know each other and ideally work together, of course, on joint projects.
Thank you so much, Karen, for this very clear explanation. So what I retain from that is you have thematic workshops, work groups, where people can exchange and communicate. So this is really transfer between members. Then you have the online consultation in order to give the voice to the diaspora and make sure that the views of the diaspora are heard and taken into account. And then I really loved the opportunity sharing and the support on the drafting the proposals. How can I join? I'm just joking.
No,
So
of course, you have to.
and communicate. And I know that you are really creating bridges and creating networks and opening people to people in the network. So this is the best way to transition towards entrepreneurship as you are planning to activate a work group on entrepreneurship. And I'm going to give the mic to Mamadou, who is an entrepreneur and who is going to tell us what does he do exactly and how does he do it.
Okay,
Mamadou,
great.
the mic is the support. I just want to tell Youssef, stop talking and listen to us, please. We're talking. I can see you talking. Okay, you guys go ahead, Mamadou.
Great, thank you so much. I just try to share my screen. I guess you see my screen right now?
Yes.
Yes.
Okay, great. Thank you so much, Nabu. And I will try to present quickly and easily what we are doing right now. And my goal is to make it like as plain as possible because I would like at least the audience to understand very easily what you are trying to do. Okay. BioWin is a digital health company, and I am one of the co-founder of BioWin. And basically, we both are pharmacists, and then we have a different specialization in epidemiology, data science, and nutrition and biology. Okay. Basically, when we decide to do a project in Mali because we develop experience out of the country, we first start try to understand what is the real problem people are facing right now and how we can help to solve that. I have the impression you are not seeing my screen.
We can see your screen.
Which one are we saying? The first one? I'm right now at the third one.
No, we can only see the first one.
Okay, so that's
okay.
the
Now we see the third one. Can you put it
okay.
in? Okay, yeah.
You see the second one right now?
Yes, we can see you.
Okay, so this is the co-founder, myself and Dr. Halima. And as I said, what we did is first, before starting this project, is to try to understand what is the problem about the healthcare right now. And we start by doing a survey, and we do a survey around, I think it was 400 participants, and we try to understand what is the big challenge. And one of the things we really realize is if someone is sick and this person is trying to looking for a health, a care, for example, would like to have a treatment, to see a doctor, to go to lab and to go to pharmacies, and we see how things is complicated for them. First, you have to leave from home to hospital to meet a doctor. You sometimes have a lot of challenge there. And then from the hospital, sometimes you have analysis to do at laboratory. Sometimes you can do the same day, but sometimes you first have to go back at home and to come back the next day. And you have to come back again to the laboratory to take your result and then to go back to see the physician. And then you have a prescription and you will start looking for the prescription, the drug, the medicine you have on your prescription. And when we do this survey, we see how things was really is still very complicated for people looking for it. Imagine someone who is sick. This is a person normally who is looking for a help. But things is so complicated, we have the impression that's an additional burden for this patient. So that's why we think about how we can simplify all this pathway for this patient. So let me again here. So from there, what we developed is a application, okay? And this application we called BioWin EMR is a electronic medical record. And by using it, what we are doing now is to simplify, to make the way for patients to receive care easy.
Is it me or has Mamadou disappeared?
I think we lost him.
I thought it was me. Okay. So waiting for Mamadou to come back. Let me check on him. Alex, maybe you can go ahead and Mamadou will finish later. You say, I told you that networks in Africa are better than in Northern America. You didn't believe me. Now I have a living proof. You remember, Karine, we had that discussion at the beginning, right?
Okay. So I hope I don't disappoint you.
No, you're in Abuja. Abuja works.
Okay. Okay. So thank you again. So as I had earlier alluded with the work that we're doing at the ICT Chamber, we started back, I think it's now, like I said, 2012 is when we started with the innovation hubs, and really the first innovation hub that we set up, that is Jokkolab, began to be like an attraction, a magnet for diaspora, a magnet for youngsters that were completing university, both locally but also foreign, but also helped us to tap into that talent, to give confidence to talent that was out of the country and looking at how to get back in. I cannot give a number exactly, because there's been so many people that whether they're coming from North America, from Europe, or Asia, that sent me a WhatsApp, a message, email. I got your contacts from so and so. I am on this group from Jokkolab, and I'm coming back. These are my specialties, and being able to plug them through, of course, the different networks. We've been able to work and connect with them into the broader ecosystem. Today, I can proudly say some of them are big in government. They're ministers or director generals at different in different organizations or agencies of the government. And for us, that basically creating the hub or putting in place these systems, we did not imagine some of these would be some of the results. But allow me just given that we're in immediate post COVID period, just around late 2019, we started exploring really how we could tap into our communities, the diaspora, in especially those ones that have maybe done different research. They're either PhD or doing different levels of R&D. And we reached out. Little did we know that some of these would be needed in the following months that came. So 2019, we started getting in touch with some of the students that were in Japan, that were in the US. And by April, May, now we were actually working very, very closely with some of the medical professionals or medical students in the diaspora, but also researchers in North America on COVID. And right as I speak today, there's one. I think we have a number of groups. Some of these WhatsApp groups have now established a research kind of a research institute that is into healthcare, and that for us has one, as Nabu said, making the connections. Okay. Connecting. These are people I didn't know. I'm not a medical person. I'm not a PhD. But one, connecting the dots, as they say. One person connects to the other, and the other one brings on a few others. Someone who's in Asia connects you to someone who's in North America, and horizontally and vertically, everything began to come together. And these are not only helping us on technology transfer as well as knowledge transfer, but also reinforcing local ecosystems, local knowledge systems. And as we speak, those that have returned, at least from their PhD, from their grad school, are now home, feeding into the local system, writing papers, but also training others. And that's that for us speaks to the power of networks, and to the power of really shared vision, shared shared vision, more or less. And that is how we are trying to leverage diaspora skills, plugging them into what we are doing, but also creating platforms that is not just technology platforms, but also human networks through which we are able to support each other or to connect with each other and build onto what we all know. So yeah, that's where we're at, and I don't want to bore you with all the information, so I'll share just a few of these. Thank you.
Thank you so much, Alex, for that very clear explanation on what ICT Chamber did and does and is still doing, and all the empowerment that you have done. So I'm going to get back to Mamadou, who's back with us, so that he can finish his presentation. Mamadou?
Yeah, I'm back. Can you hear me?
Yes, very well.
Okay, sorry, I'm back now. I don't know where I stopped. So
you stopped at the network of the platform, why you did the platform. And yeah.
And you see my screen?
Yes, we can see your screen.
Okay, great. As I said, this one is how things was complicated. So in this slide, so the slide I'm presenting right now. And then the next slide is what we did. I mean, we developed the application, and this application called BioWin EMR help now to connect with different healthcare professional, meaning physician to laboratory, laboratory to physician, and to pharmacies. So that means all of them can work together using this platform, even if they are not working on the same hospital. So that's a good thing, because this platform is a web-based platform and people can work together no matter where they are. So for example, from Bamako, you'll be able to work with someone in a specific area, even if this person is not specially in Bamako, you are able to work and to send the information about the patient and also to send the result. For example, the physician can give a prescription and send that directly, electronic prescription, to the pharmacist, or can ask for a laboratory analysis and can send that directly to the laboratory. And after the blood sampling or after the analysis is completed, you can send directly the result to the physician. So the patient don't need to do back and forth between hospital and laboratory or between hospital and pharmacies. So that's the platform we developed. And this platform has a success story. We submit this idea to the WHO, but before that, and Salian do an article and
sorry, Mamadou,
can you hear me?
Put it? It's a bit. Can you put it on in a
presentation mode?
Yes. Yeah, it's a bit difficult to
read.
Yes.
Okay. You can see it now?
Yeah, it's not yet in presentation mode, but go ahead.
Okay, this is an article written by Salient, and you can see Bawin is among the different innovator in West Africa.
Okay.
And also we present the ID to WHO. And right now, when you go to WHO platform and digital health, you can find us there. So that means if you are living in West Africa and you would like to use this platform to do this interconnection between your hospital, your clinics, or your laboratory and different healthcare structure, you can also use the platform. And right now we are on digital health atlas in WHO website.
Thank you so much, Mamadou. Thank you. Are you done? Sorry.
Yes, I am.
Okay, thank you so much. I think it's very important what you have. We have seen the. I was going to transition from you to Alex, but you already. If you can remove your presentation, I would.
Yes, I
please.
can.
Yes, thank you. From you to Alex, as Alex was in ICT, but you're creating networks of healthcare professionals in Africa, and I think it's very important and it's very relevant. And you have decided to do so as an entrepreneur. So I want to congratulate you and to encourage you. And we're looking forward to have it in different countries. And I know the networks that are going to be built today, DIDA, thanks to ADYFE, are going to help you expand that project. And I can see Alex smiling and imagining how he's going to welcome you at the ICT in Kigali, right?
Actually, that's a conversation we need to start with Mamadou.
Definitely, I believe so. I believe that is the reason why
I see that he already has Babel. I don't know how you're working with Babylon, but most likely you because I've seen in his slides, Babel is there. So
yeah, looking forward to hear a success story, something positive, some positive outcomes of that DIDA conference and ADYFE. And I think Karen is smiling because this is what she wants to see happening as one of the financer of the conference. Okay, so we're going to move on to, I'm going to ask you two very quick questions. We don't have many minutes left. We have 12 minutes left. What is, I'm losing my words. I think I'm too emotional. What is it that, what are the success stories? I would like each of you to tell me one success story that has come out of what you're doing. One success story, for example, Karine, in networking, putting all these people together, all this plugging. Can you tell me one success story, one thing that you remember, that one thing that has touched you, that has really rose your attention? Karine, you're on mute. Maybe I can't hear you. For some, yeah, you're.
I'm on mute. Yes, I was on mute.
Thank you.
Yes, I was saying that it's difficult to pick only one example. I can give maybe several very small and very quickly.
We only have 10 minutes, so.
For example, I can present the case of the work done by the working group on humanitarian actions that has produced a policy brief on the engagement of African diaspora organizations in humanitarian aid. And it's a policy brief, so that was done collectively, a very good one, a very good quality, and that was published on the occasion of the International Day of I think it's a World Day of International Aid. So it's a good example of collective work with an extremely effective and good quality outcome. I can also mention the fact that a consortium was created to enable some of our members to apply for European funding. They were not selected. That's the reason why I think it's very important to know what we mean by success, because in that very case, even though they were not selected, the process was very important because it enabled them to work together and to get to know each other. And it was very satisfactory that after the publication of the result, they say that, okay, it's a pity we were not selected, but it was a pleasure to work together, and we want to do that again. And maybe the third and last example is DIDA, because it proved that we can also enable that sort of event, gathering so many people to happen. Just as a reminder, we provided some financial support. And when we see how event is organized so flawlessly, and when we see that it brings together so many different actors, for us, it's a success.
Thank you so much for these heartwarming stories. And yes, because I believe in collaboration, I believe in co-creation, I believe in cooperation. And this is what the diaspora is, through your organization, is showing up as an example. And thank you so much for these very positive examples. This is how we rewrite positively the narrative of Africa altogether, whether outside and inside. And thank you so much, Karine. I will come back with what you did and at the conclusion. Mamadou,
Yes.
what is your success story? What in what you're doing as an entrepreneur that connects the medical ecosystem in the sub-region? What can you share one success story with us?
Yes, I can. How long I have, 1 or 2 minutes?
2.
2, okay.
Maximum 2.
2, okay. Because I know we are like, so to keep it short and simple, I think one of the biggest success story is having this platform validate, approved by WHO. So meaning right now, everyone can like go on the WHO website and to be able to use this platform. And we can use that like everywhere in West Africa. For us, that's a big success story. You know, we have been talking about African Union. So that's a kind of unionization you are creating among healthcare professionals, first by country and then between country from every coast or from Senegal or Mali. You are able to work together using this platform. For us, that's one of the biggest achievements.
Thank you so much. That's a fantastic, another positive story, another beautiful, heartwarming story of a positive narrative of the continent that that ADYFE is rewriting and contributing, writing here with all of us. Thank you so much, Mamadou. And Alex, you don't have much time. You have 2 minutes.
Yes, a lot. So for us, I think I'll point to, again, one of the companies that that we hosted back in 2014. Young Diaspora writes to us, says they want to run a small launch for their drone business, and they did. We welcomed them, made connections here and there, hosted them for different events, exhibitions. And today they are one of the leading drone businesses in Rwanda, providing services from healthcare to agriculture to infrastructure. And they've hired quite a number of people. They have the first fleet, the first team of drone pilots, qualified drone pilots, and they are serving also in Cote d'Ivoire. So that's for me, that makes the perfect example of a success story. And that company is called Caris Unmanned Aerial Systems.
Okay, thank you so much for also you're showing the interconnection of African countries together, the sharing of expertise, and at the end of the day, I see that we don't talk about people in Africa as diaspora, because I believe that nowadays any African can move wherever he wants. Is Africa, it's his country. And if I always tell people, if nobody wants me, I know that Rwanda will want me.
Yes,
right?
yes.
Alex?
Yes, it's open, it's free visa, so.
I know. Amazing. And thank you so much to the three of you. What I keep in mind from that discussion, the first part of the discussion, and then I will give you the mic to have to let you give a takeaway to our participants, is the strength of networking, the strength of collective intelligence, the strength of rewriting together a positive narrative for our continent in order to show what we can do together as a diaspora, but also together as African on the continent and outside of the continent. And thank you so much, ADYFE, for putting on the scene these amazing people, these amazing African entrepreneurs or social entrepreneurs that are really contributing to the transformation of the continent. So I'm just going to give you the mic. You have 30 seconds each to tell me, to give our audience key takeaway. How can we do better? How can we foster the mechanism to network and to be able to not more to invest, but to soft land as entrepreneurs in Africa? How can we either foster it or do it? Please share with us your mot de la fin, as we say in French, your key takeaway that you can share with our audience. I will start with Karine.
When it comes to networks, generally speaking, I think that building a network and ultimately a community takes time and dedication. And this is something that people have to keep in mind, because a community or a network are living organism that need to be nurtured, otherwise they die. So it's important to put in the effort, to be extremely patient, but in the end it is rewarding because we can do so much more when we act collectively. So it is definitely worth the effort.
Wow, thank you so much. Thank you so much, Karine. Awesome. Thank you. Mamadou?
Keep it short.
Mamadou, are you back with us?
Yes, I am. Can you hear me?
Yes, we can hear you.
So
what can you give
keep
to
it
our
short.
audience?
Yes, as a mot de la fin.
Yeah.
As the end word. So what I will say is, in Africa, we have a lot of challenge, but also that's an opportunity for us to make a contribution.
Yeah.
We are not able to make this contribution alone. We need to work together. So we need a network. It's not easy, but we have to work to build a strong network to be able to tackle all the different challenges we have. It's not only in healthcare, but I think it's almost in all areas. We need to work together to build this network. So that will be my last word.
Wow,
thank you for this opportunity.
Thank you. It's awesome. Thank you again, Mamadou. I will come back and conclude because I'm just drinking your words that are just awesomely positive and filled with hope and strength. Yes, Alex, your turn.
I'd say for me, it's ideas multiply when they are shared, and shared on platforms or in networks of people with multi-disciplines and different backgrounds. So the more of us, the more we network, the more we exchange amongst ourselves, the better our ideas become. And that I think is what we need on the continent in order to make sure that we actually building systems that are cross-border and innovations cross-border. Thank you.
This is thank you so much. I don't know how to thank you. This was very rich conversation, lots of input, lot of storytelling, interesting examples. But what I'm going to conclude with, I'm just going to conclude with the 3 takeaways that you have shared, each of you. Building networks takes time, effort, patience, but in the end, it's rewarding, said Karine. Challenges are opportunities to make contribution, and together we can succeed as we build strong networks, says Mamadou. And Alex says ideas multiply when they are shared on platforms with different ideas. We have better ideas when we share them with others and improve them as we communicate within a network. This is the mot de la fin, the end of the panel. I want to thank our participants for their generosity. I want to thank ADYFE for trusting me in moderating that panel, and thank for our collaboration in the last years. And if I hadn't met Youssef at an event in Bamako, we wouldn't be here together. It's connection, 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 networking, plugging, opening doors for others, sharing opportunities together in order to, as I love saying it, together transform positively the narrative of our continent altogether. Thank you, and have a wonderful afternoon, evening, morning, wherever you are. Bye. I saved all your numbers so that we can keep on connecting. Mamadou, I knew you. So this is what communication. Thank you so much, ADYFE. I think Youssef has a word, mot de la fin for us. Youssef,
thank you guys. It was really interesting to see you far away from us, but being able to share with us here. So unfortunately, we had to do it that way because we are continuing with the workshop now. But those inputs were really important for us to carry on the exchange here between the diaspora and the continental apps. Thank you, Nabu. Yeah, since we met here, definitely she's our moderator of vedette from the diaspora living in the continent. Thank you so much for your all support. Thank you, Karine, Mamadou Dako. Alex, thank you so much, because Alex was, I just contacted him yesterday because one of our speakers got sick, and we exchanged and we met a couple of hours later on and we made it. Thank you so much.
Thank you.
To you all.
Thank you.
And you can stay connected because we are continuing with the workshop, the exchange, so you can see also what's going on here.
Okay, perfect. We'll be here. Thank you.
Thank you very much.
Bye.